Freedom from Pain programs incorporate Eastern and Western knowledge to provide information on health, nutrition, exercise, stress reduction, and energy medicine. They are designed to further the understanding of the mind-body connection and the improvement of general health. The information contained in this video is not a recommendation or therapy for any particular illness. For optimal health benefits, please consult your physician.
So I have had 2 treatments from Dr. Tong, and I went back for an appointment that I had to keep about 2 months after the August one, and the ophthalmologist, after a field vision test, was absolutely amazed. He said, well, he said, this is amazing. He said, you've got a 60% improvement. He said, this is wonderful.
I have lung cancer. And for the lung cancer, they have given me chemotherapy, which left me completely bald, and radiation, which now gave me a lung problem of a pneumonia, which I started with Dr. Tong because the other doctors said they couldn't do anything for me anymore. That was it. I just had to live in hope. In fact, the hospital issued me a walker because I couldn't walk. I had neuropathy of the feet and the legs. I mean, I was walking like I was a drunk, and I couldn't walk a straight line. I threw the walker away, and when I came to Dr. Tong, October the 6th, I started to walk a week after that. And I was doing, I'm just doing very well. I hope it continues. If it doesn't continue, well, I'll make another tape. So far, so great. I mean, after going on not even a month, 3 weeks. This is a miracle. Because I have started here October the 6th, and this is November the 10th. I had to be carried in here. That's how sick I was. I had 102 temperature to 104. Nobody could do anything for me. Today, I'm fit as a fiddle. I will continue, because as fit as I am, I'm afraid that will come back again. I don't think it will, but there's no amount of conversation, I can tell you, where I'm concerned, if you don't feel it yourself, and I'm sure you could and would, and we'll try it. It's probably one of the best ways to go for your health, is acupuncture and herbs.
I've had knee trouble for about 3 years now. I finally went to my family doctor, and he told me I have arthritis. He told me there wasn't anything they can do. They can't cure it, he says. So later on, we talked about giving me cortisone shots, and he says, no, I don't think that'll work either. And finally he says, would you consider having knee replacements? I said, no. I said, it's a little too late for that. But finally I talked to my neighbor, and my neighbor suggested that I go to see Dr. Tong. Well, yesterday I played golf. It didn't hurt a bit. I'll tell you, I haven't had anything like this happen to me in years now. Boy, I'll tell you, I don't know why I didn't come in here sooner. I've been told about this many times, but hey, I thought it was voodoo, you know. Who believes you can stick a needle in a guy and make him well? Well, it's working with me, I'll tell you.
And I was diagnosed with a trigeminal neuralgia. And he put me under Tegretol, sometimes Dilantin. And then, after a couple of years, I keep taking all those pills, and it's weakening. And then I decided to went to acupuncturist, and it didn't help.
Yes.
I don't know if you have any recommendation that I can do right now, because
okay.
I want to get rid of this pill that I'm taking right now.
Yes. The pills only cover up your symptoms. they'll never get to the root cause of the problem. The problem, just like Dr. Berger's example of a failed back surgery, the other caller that have the paraplegic problem, okay, is the acupuncture is not strong enough to control the pain. Okay, you need an anesthetic injection to improve the circulation, to control the pain first, and the acupuncture and herb to treat the underlying problem. We treat many problems like trigeminal neuralgia, TMJ, and so forth, okay? But you have to treat the cause of the problem and not the symptom of the disease.
Acupuncture alone is not adequate for more serious disorders. Combining it with anesthetic blocks is much more effective.
After my medical training, I spent 8 years in surgical anesthesia. Acupuncture and pain control were just a side hobby. Later on, I began combining epidural, cryosurgery, and other anesthetic techniques with acupuncture and went into full-time pain management.
I do notice the difference between Dr. Tong and other acupuncturists that I've gone to maybe 10 years ago. He uses a method of combining east and west. By that, he gives you shots to open up the channels, and it works much, much faster. I mean, my recovery in 1 month is uncanny.
The acupuncture I had before was great, but with the shots added with it is so much more effective.
I had the acupuncture at a clinic in Long Beach before it closed. I had 10 treatments, but nothing compared with the ones I've received from Dr. Tong. It would have taken, I would guess, more than a year of acupuncture to have come any place close to where I am today. The nerve blocks have helped immensely. They just, I get a relief the same day. It's just been wonderful.
The combination of the Eastern and Western medicines, where the acupuncture is mixed with the injections, it just amplifies the effects of the acupuncture, and the effects are incredible. He's really come across something that it's hard to believe. You'd have to experience it for yourself.
I know that makes an immediate difference. That I think that if we were just doing plain acupuncture, I wouldn't be getting well so fast. But I'm just amazed. It's really like a miracle, the difference just from the shots that he uses and the places that he knows exactly where to put it and where it's going to hurt. And afterwards, it doesn't hurt anymore and everything gets better.
I have sciatica, arthritis in both knees, and I had an MRI, and a neurologist told me that 96% of the surgery is okay, and I would be in the 4% that is not okay. I take anti-inflammatory that makes my stomach upset. It doesn't do any good at all. And every time I sit, if it's just for a second, and I get up, I have to wait till all the bones get in the right places before I could take that first step. And I'm wondering if any of that acupuncture would help.
Acupuncture is not good enough to control your pain. Your pain comes from the fact that in the sciatic area, your muscles are too tight and it's grabbing on the nerve. So when you sit on it, you apply extra pressure, and that's what causes the pain. So you have to release the muscle spasm, and the nerve blocking injection are much better than acupuncture. Arthritis and your sciatic nerve problem can be cured. And I know that's a big claim, okay? But I have done many of it. In fact, we said earlier that I'm writing a paper, a retrospective study involving about 3,000 cases, okay? And sciatic nerve, back pain, back surgery, failed carpal tunnel surgery, all different things is really a majority of the problem I'm treating. Right now, except that right now that I'm treating a lot of non-pain disorders. But your problem can be reversed without surgery. The best thing is that don't take surgery, do the treatment first, because if the treatment doesn't work, okay, you have about 5 to 10% chance that...
And age doesn't make any difference.
Yeah, it won't cause any harm. But once you do surgery, you got scar, you got inflammation, you got adhesion, that it can get worse.